Hello friends, let us now learn about portal hypertension in children. So this portal hypertension in children, here there is elevation of portal pressure is seen to be more than 10 to 12 millimeters of Hg. And if you see the site of based on the site of defect, you can divide the portal hypertension into three types. One, we have pre-sinusoidal or pre-hepatic portal hypertension. In pre-sinusoidal or pre-hepatic portal hypertension, this is due to portal vein obstruction. This is due to portal vein obstruction from any cause. This is the most common type of portal hypertension in children. Then if you see the second, which is sinusoidal or hepatic portal hypertension. This is due to the obstruction inside the liver. So this can be due to any form of cirrhosis of liver due to any cause like autoimmune cirrhosis, Wilson's disease, hemochromatosis, neonatal hepatitis, anything leading to cirrhosis of liver leading to portal hypertension is sinusoidal or hepatic type of portal hypertension. Then we have the next type of portal hypertension, which is post-sinusoidal portal hypertension, or also called as post-hepatic portal hypertension. This post-sinusoidal or post-hepatic, there will be obstruction in hepatic vein is seen, or there can be inferior vena cava obstruction, which will tell us about which is an example is Budd-Chiari syndrome is an example of portal hypertension. That is post-sinusoidal or post-hepatic part of portal hypertension. Thank you for watching.